my name is Amanda Sheehan, and I'm a nurse practitioner at Joslin Diabetes Center in Boston, and I'll be talking to you today in part 3 about obtaining CGM through the commercial insurance process. So in part 3, I'll be talking about obtaining CGMs for patients through commercial insurance. What is the commercial insurance process? If it's a pharmacy benefit, then the provider simply sends a script to the pharmacy directly. For those sending in for a Dexcom G6 or a Libre 2, no reader is required, so patients only need a script for these sensors and transmitters alone. Ideally, the pharmacy will call the patient and let them know when it's ready, or that it is covered, or not covered, and if a PA is needed. Sometimes this doesn't happen, and the patient should be advised to call the pharmacy to check on the status of the approval. Patients should call their pharmacy within 24 hours to check the status if they have not heard. If they learn that it's not covered through a pharmacy benefit, then they need to follow the DME process, and that would require that they reach out to a DME company, call them directly to initiate the process to send paperwork to their prescriber. Now, what do we do if a patient is denied coverage? Well, first we need to ensure that proper documentation was submitted. Was the correct criteria included in the note? In the assessment section, we need to ensure that we've documented that they are on 3 injections a day, that they require frequent adjustment, and that they're being followed at the appropriate intervals by their provider. If all of this has been done and we receive a denial, then the next avenue we pursue is either writing a letter of medical necessity or requesting a peer-to-peer review. Important information to include may be hypoglycemic events, how severe they are, how frequent they are, if they qualify as level 3 hypoglycemia, that is hypoglycemia requiring the assistance of another person. Do they have hypoglycemia unawareness? Have they had any injuries, adverse events, or other types of accidents related to hypoglycemia? Additionally, you can include information about any injury or event related to hyperglycemia or glycemic excursions that are severe. Further, it would be important to note any concomitant medical problems that make CGM use essential for their safety. As plan coverage can change yearly, patients who are denied should check in around the period between November and January to determine if changes have occurred to their plans. You can always try appealing again the next year or sooner if there are changes to the patient's treatment or if safety issues arise making CGM use more urgent for safety. Sometimes when I resubmit an appeal or obtain a different peer-to-peer review, I'm able to be successful. Thank you for listening, and if you'd like to learn more about Time in Range, please visit the American Diabetes Association's Time in Range website at professional.diabetes.org/time in range.